I am an ICU nurse and follow me for my 12-hour night shift. I usually wake up at around 5 p.m. but sometimes my dog would wake me up at around 4:30 p.m. As you can see, he likes to snuggle. He always wakes me up with lots of kisses. When I wake up, I'll make my coffee, I'll exercise for a bit and take my shower and get ready for work. I start driving to work at around 6 p.m. because I like to look at my charts. Okay, there's a lot of spots, so that's good. Also, sometimes I prefer to drive earlier to find a good spot to park. Alright, I found a good spot. And now we're heading towards our unit, and it's not that far. It's close to the parking lot. I put my stuff in my locker. I badge first, and this is our locker. Before I head out and play a nurse, I try to fix my hair, my mask. Okay, come on, let's go. Time to go. I then head out to the nurse's station just to see which one is my patient for the night. And I have one patient, a fresh open heart patient, and I love it. So now I have here my pens, paraphernalia, my report sheet, and cabbage sheet because we have to do hourly intake and output. I then sit in front of the computer just to check on my patient's chart to make sure we don't miss anything. I check on the procedures, their medical history, and all that stuff. I then clock in at around 6:40 or 6:45 p.m. and go find the nurse to get report. So our reporting is done at bedside, but I cannot show it to you due to HIPAA. And with this, it's like seeing the patient together and seeing what the nurse is talking about and kind of like assessing the patient already. So after I get a full report, I do a head-to-toe assessment, I do oral care, peri-care, I clean the Foley catheter really good. And after I'm done with my assessment, I'm gonna sit and put everything in the chart. So now we're gonna document everything and anything we've seen on the patient from head to toe, their skin, their butt, if they have pressure sores, and even a simple skin tear, we really have to document. So for a fresh open heart patient, you have to check hourly blood sugars, urine output, their chest tube output, and hemodynamics. So we have to make sure the patient pees at least 30 ml per hour, and we make sure their blood sugars are corrected with an insulin drip. So now we have to go to the medication room and gather all the medications and administer it to the patient. I usually give it 30 minutes ahead of time. So as the night go by, you have to continue doing hourly blood sugars, urine output, chest tube output, hemodynamics, make sure the patient is stable, and you gotta chart all of that. Now at around midnight, I'm gonna go get my break. I'm heading down to the cafeteria with my coworker, and I'm hoping we have a good food for the night. And this is gonna be my dinner for tonight. It doesn't look good, but it will work. Having a little pee break, fix my hair, my mask, and just relax for a little bit. Sometimes it's hard to be awake at night, so I always think about the vacation I'm going next to just give me a little inspiration. After my break, I go back to my hourly blood sugar checks, urine output checks, chest tube output, hemodynamics, make sure the patient is stable, and make sure they're not in pain, give their pain medications, and whatever they need. So at around 4:30 in the morning, I gather all my lab supplies and I draw the blood because we want all the lab results before 6 in the morning when the doctors come in and we could address it and talk about it at rounds. After drawing blood, I go ahead and give my patient a whole bed bath, so I'm getting all my supplies. And I'm gonna ask for another nurse to help me because you don't want to be turning a fresh open heart patient by yourself. It's gonna be really painful. And we're almost done with our shift. It's 6 in the morning and I almost filled up my hourly cabbage sheet. I make sure I finish all my charting and then I give report to the morning nurse and badge out, walk to my car, and go home. I usually feel so hyper when I get out in the morning because I'm so excited to see my dogs. Hi! Oh my goodness! Oh my goodness! Hi! Oh, it's okay. Mommy's home already. Mommy's home already. I miss you. So when I get home, I would just relax in the backyard with my dogs and take it all in and be grateful for what I have, for the job I have, and take a shower and go back to sleep. Oh my goodness. Oh my goodness. Oh my goodness. Oh my goodness. Thanks for watching.